Passing the Nclex is not just about memorizing these all textbooks or to cram these all the books. It's about mastering the logic behind your test. You do not need to panic and no need to guess, as I am going to show you the exact step by step strategies to decode your questions, eliminate the wrong answers with the confidence, and think like a safe practice nerds. Let's stop worrying and change your mindset and dive straight into the strategies. So the first strategy that you have to kept in your mind while answering the questions, the first one, you always have to think, analyze the question with the help of the nursing process. So what is nursing process? It is the ADPI. As you already know, it's the first step is the assessment, diagnosis, planning, implementation, and then evaluation. So always read your answer and answer with this ADPI or with the nursing process. Think about the Nanda diagnosis while answering your questions. The second step that you have to be remember while answering your question, second approach, that is the Maslow's hierarchy needs theory. So what is that? You always have to think from the basic to the advanced theory, from the basic to the higher level of the Maslow's theory. According to that, you have to answer your questions. So basic needs comes first, then advanced level, that is the higher level, will come at the end. Next, you have to answer your questions with the help of the ABC, that is what? Airway, breathing, and then circulation. So prioritize the question, prioritize the situation as per the ABC scenario. Otherwise, in case of the CPR situations where you need think that question is came from the resuscitation, then you always answer by the question with the help of the CAB, that is the circulation, airway, and then breathing. So these are the four steps right now we have discussed. The first one was the ADPI, second one was the Maslow's theory, third one was the ABC approach. In case of the CPR, you have to, or the resuscitation, you have to follow the CAB, CAB. Next, other bonus tips that you have to be follow while answering your question. Acute patients problems will always come first. Like what is the acute problem? On that you have to focus first, then on the chronic problem. So whatever the chronic problem patient have, that will come at the second or at the last. The first, there will be the acute problems come first. The second thing that you have to be remember in the bonus tips, unstable patients will always, you have to be attend safety nurse. What will be the safe nurse? You always have to answer or attend which patient first? That is the unstable patients. Next, stable patients will we have to see the, or the priority is the second priority, or the last priority will be the stable patient. Next strategy that you have to be follow while answering your question is, you always have to focus on the actual problem. What is the major or the priority problem of the patient, then the potential problem. Means you have to focus while answering your question on the actual problem. Next approach that you have to be follow, you always have to attempt your questions as the least invasive, from the least invasive to the escalative. Means you have to answer your questions from least invasive to the major or the most invasive questions or the options. Next and last, always think, always answer by the questions like what? You always assess first. Assessment comes first, then intervention. So assessment always comes first before the interventions. Always interventions or intervene your patient at the last. So with these strategies, you can answer maximum your questions and you can eliminate these SATA questions with these priority nursing interventions. Hope this video will be helpful for you guys. Thank you for watching the video. Stay tuned.